Hello everyone, I'm Anastasia. I welcome you all to this new session of Fundamental of Nursing. So in our previous session, as we have discussed about what record report means, and we've also discussed in detail about what record is, right? So in today's session, we are going to deal about reporting. So in today's session, I am going to teach you about what is reporting, what are the importance of this reporting, as well as what are the types of reporting. So here, as we all know that reporting is a verbal or a written communication of data regarding the client health status, their disease condition, the treatment which has been provided to them, the outcome, as well as their responses. So this reporting, as I've said, can be either in the form of a verbal or a written form. So here, what happens in this reporting is that we will be communicating about the client condition, about the client health status, about the various treatment, the various procedures which has been performed for them, and also about the outcome and their response. This reporting also facilitates the clinical decision making, the continuity of care, and if there requires any modification of care, and also this reporting also facilitates the coordination between the healthcare team members. So as we all know that while providing care for the client, it is very essential that there must be a proper coordination and cooperation between the healthcare team members. Why? Because only if there is presence of this coordination and cooperation, then only the care which we are providing will be an effective one. These reports, it's not essential that you must only do it daily, but it can also be compiled and be done at once, weekly, monthly, quarterly, or even annually. So here in report, what will be happening is that we will not only be communicating about the condition of the client, will not be communicating only about their concerns or the outcome, but here we will also be summarizing all the services which has been provided by the client or that particular institution. These reports may also be in the form of an analysis of some aspect of a service. And since they are based on records and registers, so what happened here is that it is also relevant for the nurses to maintain a record regarding their daily care loads, regarding the service loads, as well as the activities which has been performed by them for that particular client. So this is what report is about. Now let's move on to the next one, that is the importance of reports. So we will be discussing here about why reports are important. Good report saves the duplication of any effort as well as eliminate the needs for investigation to learn the facts in a situation. So here what happens is that if there is a good report from one nurse to the other, then it will save the duplication of any procedures or any treatment which has already been provided for that particular client. And not only that, it also prevents the need for investigation in order to learn the facts in a situation. So here, if any procedure has already been performed, if any treatment has already been performed, then it saves the duplication of it so that it will not be redone again and again. A full report also saves the embarrassment which can be caused due to ignorance of a situation. So here, whenever you report, you should make sure that you must do it completely and in a detailed manner. Why? Because if you do it incomplete, then there can be, an embarrassment which can occur because of the ignorance of a situation. Like here, for example, in case if you've already checked the blood glucose level of the client, but you have forgot to report this to the other nurse, who is now responsible for taking care of the client. So what she may be doing is that she may go again to the client and say that I have to check your blood glucose level. So here, when the client or when the family members say that, the other nurse have just checked it a while before, then this can lead that nurse to suffer from embarrassment. Why? Because this will show that she didn't get the idea or that the information has not been communicated to her. We must also make sure that whenever we report anything, we must do it thoroughly so that the patient will be getting a better care. So here, for example, if a patient was advised to perform, any physical exercises. So here, if the nurse who was, on that particular shift, she forgot to do so, she forgot to assist the client or she forgot to, advise the client to perform that particular procedure. So when she leaves and when the next nurse comes, if she has not been reported that this particular client had not yet done the exercises which was being advised to perform, then she may be be thinking that, okay, it is already been done by the other nurse and she will not do it anymore, right? So, by this, if you don't report it properly, then, this care which you are providing may be altered. So in order to make sure that you provide a high quality care, in order to make sure that the patient receives a better care, you must make sure that you must report everything in a detailed manner. Not only that, but if you as a nurse give a complete report, then it also enhances the sense of security. Why? Because here, if the other nurse or if even the client knows that, all the detailed information has been given to them, then they will feel more confidence, and it will also enhance the sense of security. Not only that, but this complete report also gives a sense of security, which comes from knowing all the factors in a situation. And the last importance is that it also helps in the efficient management of the ward. So these are the various importance of a report. Now moving on to the next one, that is the types of report. So here there are two types of report. The first one is the oral report, which means the report which is done orally, and the second one is the written communication. So usually these oral reports are given when the information is for the immediate use and not for permanency. So here, for example, when there is change of shift, the report, the communication which occurs between that nurse and the other nurse who will be in charge of the patient is known as an oral communication or an oral report. And the next one is the written report. So here records are to be written when the information is to be used by several personnel. So here, as I've said, that whenever you provide care to a patient, you should make sure that there is a good coordination between the healthcare team members. Why? Because here each and everyone play an important role in providing care to the client, right? So here, whenever any information is to be communicated to several personnel who are involved in providing care to the client, then it is more preferable that these reports should be a written one. So here, not only that this report is important in order to provide information to the other healthcare team professionals, but here this written communication will also serve more or less of a permanent value. For example, we can say the day and the night report, the census, the interdepartmental report, as well as the needs which can arise according to the situation, the events, or even the condition. Here, the reports which are usually used in the hospital setting is of three types. The first one is the change of shift report, the second one is the transfer report, and the third one is the incident report. So the change of shift report, so whenever there is change of shift while you are reporting, you can do it orally, by face-to-face interaction or by audio taping, recording, or even during rounds at the client bedside. So here, whenever there is a change of shift reports, there are certain things that you as a nurse must keep in mind. The first one is that you should provide only the essential background information about the client, but you should not review all the routine care procedures or the tasks which has been performed for that client. You must identify the client nursing diagnosis or the other healthcare problems or even the related causes, but you should not review all the biogeographical information. You can also describe the objective measurement about the client's condition and response to the health problem, but you should not use critical judgment or any critical comments about the client behavior. And also, while you are doing this, you should also make sure that you must continuously review the ongoing discharge plan and prevent yourself from engaging in any idle talks or gossip. You should also evaluate the results of the nursing care as well as the medical care measures. And here we should not simply describe results as good or poor. We should be specific. So whenever there is a change of shift, whenever you report any information about the client to the other nurse, you should make sure that you should be specific. Like whenever you talk about the condition, whenever you talk about the treatment or the outcomes that you have, observed after you have done the particular particular procedure, you should make sure that you must be specific with it. You must not say that, yeah, the client status is improving or the client status is becoming better, or you should not say that, no, after performing that procedure, the client status is becoming worse or deteriorating. No, what you must say is that, yes, after I have performed this procedure, I've seen that his metabolic level is increased, his fluid volume is increasing, or his elimination pattern is increasing, or something like that, which will show that, after performing this procedure, this is the outcome. You should be very specific. And the next is that you must also be clear on the priorities to which the other nurse must perform as soon as she takes the charge. So here what happens is that before you transfer your duties, before there is a change of shift, you must make sure that there are a certain priorities which is listed in order for the other nurse to perform. Here you must also make sure that you must not force the oncoming staff to guess what to do first, but you must be the one who must tell them what are the various things to be done first. So these are the various things that you must keep in mind whenever you are doing the change of shift report. Now moving on to the second one, that is the transfer report. So here, as we all know, that patient will be frequently transferred from one unit to the other in order to receive different level of care, right? So here, whenever you are giving the transfer request, you must make sure that you include the following information. The first and the most important thing is that it must include the client name, the age, the sex, the medical diagnosis, as well as their primary doctor. The second is the summary of the medical progress up to the time of the transfer. The third is the current health status, that should include both the physical as well as the psychosocial health status of that particular client. Then the current nursing diagnosis or any health problems and even the care plan. And it must also include any critical assessment or even the interventions that must be completed shortly. And if the client requires or need any special equipment, any special procedure to be done, then these must also be reported whenever you are transferring the client from one unit to the other. So these are the various information that you should include whenever you transfer the client from one unit to the other. Now moving on to the third one, that is the incident report. Here, nurses usually become involved in the client-related incident at any point of time in their career. So here it is very important that we nurses must understand the purpose of this incident report and do it in the correct way in order to report that particular information. So while doing the incident reporting, these are the following things that you must keep in mind. The first one is that only the nurse who was present at that point of incident or only the nurse who had witnessed that incident can file this report. She must also make sure that when she is reporting, she must do it in a concise manner about what had happened, especially the objective terms. She must not interpret or attempt to explain the cause of that particular incident. She must also describe objectively about the client condition when the incident was discovered. She must also make sure that she must report in case if any measures had been taken by the nurse, by the doctors, or even by the healthcare professionals at the time when that incident has occurred for the client. So here it is very important that whenever you report any incident, you must do it completely, concisely, as well as accurately. And you should also not fear about anything. Why? Because here the nurse will never be blamed in an incident report. So here, after all of these things is done, it must be made sure that this report is submitted to the appropriate authority as soon as possible. And also, as a nurse, you must keep in mind that you should never make a photocopy of any of the incident report. So these are the various things that you must keep in mind whenever you are reporting any incident. So now we have come to the end of this topic. So in today's session, we have discussed about reporting. We have discussed about what reporting is. We have discussed about what is the importance of reporting, especially for us nurses. Then we've also come to know about the two types of report, that is the oral report as well as the written communication. And at the end, we've also learned about the reports which is used in hospital settings. So we've come to know that there are three, that is the change of shift report, the transfer report, as well as the incident report. report. So I hope you guys have got a clear insight of this topic. I'll be meeting you guys in another session whereby we'll be discussing about the furthermore topics of this particular unit. So until then, have a good day. Thank you.